With President Trump challenging pharmaceutical companies to justify success of the COVID-19 products, and with the recent removal and resignations of several top CDC officials, I'm sitting down with Dr. Robert Malone to get his insights into what's going on behind the scenes.
He's basically put his foot down and said, guys, I'm tired of this. Let's get to the bottom of it, get it cleaned up, and move on.
What does the future hold for the CDC's Advisory Committee on Immunization Practices, ACIP, of which Dr. Malone is one of the members? What are the challenges and major opportunities he sees? This is American Thought Leaders, and I'm Yanya Kellick. Robert Malone, so good to have you on American Thought Leaders.
Thank you for having me back, Jan. These are interesting times.
Well, incredibly interesting times. Over the weekend, President Trump had a Truth Social post that when I looked at it, I thought to myself, my goodness, has the world changed? What was your reaction? You said, very interesting, but I know there was a lot of thought behind that.
What we've got is President Trump putting out a very thoughtful post on Truth Social, his home platform, in which he is taking the position that he has questions about the safety and effectiveness of the COVID products, medical products in particular. He never says vaccines. And he's apparently perplexed that the information that has been shared with him from Pfizer and others about the success of Operation Warp Speed is not universally shared by others. And he is, in a very cautious way, laying down a challenge to the pharmaceutical manufacturing industry that they make public the information that they've been sharing privately with him. And one can infer that the logic here is that this will be made public and subjected to public scrutiny. And Jan, you know as well as anybody that there was an attempt to not make any of the information available having to do with the clinical trial data and post-marketing data acquired by Pfizer in particular. But the question is, were too many corners cut? And were people mandated and otherwise persuaded, enticed, compelled to accept a medical product that wasn't as safe and effective as they were told? This is particularly important in that most, if not all, of the major criteria that underpin modern biomedical ethics were breached in that response. And informed consent was not only not required or enabled, but it was actively suppressed, is what currently the data indicate, is that the communications, both from the sponsors and from the federal government, actively suppressed information about potential adverse events in particular. And that's just not acceptable in terms of modern medical bioethics, that it became the standard. So it is a huge event that President Trump on his Truth Social platform raised these questions that he has really avoided asking in the past, and has been that's been perhaps the largest reservation that his base has had about him, and certainly the Make America Healthy Again grassroots movements have had about President Trump, is his insistence that this program was a spectacular success.
You know, the president talks about the CDC being ripped apart over the question, indeed, of, what was the effect of these products? And maybe, why don't you chart for me a little bit of the process of getting here? Because, this didn't come out of the blue. There was a whole lot of activity. I mean, almost too much to cover as a media company, frankly, and or as yourself on your platform. But why don't we start with where this actually came from? What catalyzed this?
So I agree. Those were remarkably strong words from the president, ripped apart. And let's walk back over the last 3 weeks. 3 Fridays ago, in the evening, about 5 p.m., I think we can best say, unhinged young gentleman decided to open fire. The term has been used, a spray of bullets on the outside of the Centers for Disease Control and Prevention building. Unfortunately, a police protection security personnel assigned to the CDC, who is a father of a young family, lost his life in this attack. No one else did. The facility itself was not breached. And by the way, ever since that event 3 Fridays ago, virtually the entire CDC staff has been on paid leave, which they will need to return to work on September 15th. And then that happened in the context of what's been about 7 weeks of slow walking of the ACIP subcommittee working group on the coronavirus vaccines, attempting to get CDC senior leadership to authorize what's called a terms of reference statement, which for those of you that are not federal bureaucrats, you might just call it a scope of work. But terms of reference is the terminology that is approved within the CDC, as well as authorization to query the FDA for the data that were used to support the CBER director, Vinay Prasad's decision to authorize the Moderna product for high-risk children and adolescents, which is still pending, that authorization, but that had to go through CDC approval, vetting, lawyers, etc. And there was a concerted effort to control what that agenda would be. And it finally came to the point last Monday, apparently. I infer this. And by the way, I just need to give the disclaimer, Jan. I'm speaking in my personal capacity, not as a member of the Centers for Disease Control and Prevention or the Advisory Committee on Immunization Practices, or as a special government employee, or as a representative of the U.S. government. My opinions are my own in this interview. And I haven't spoken to Bobby directly or Stephanie about this cascade of events, just to be clear. What I've learned from reading tidbits from the likes of Stat News and the Washington Post, etc., and then a little bit of chatter from insiders, not Bobby or Stephanie, was that last Monday, so 2 Mondays ago, the secretary called in the newly confirmed, only been on the job for about a month, director of the Centers for Disease Control. And there was a discussion that apparently included the issue of letting go certain CDC senior staff. I infer those senior staff may have been involved in the slow walking of the ACIP terms of reference document. And I know that in prior statements in the context of her confirmation, the director had made a statement to the effect that she would not terminate any of the existing CDC senior staff. It appears that the secretary asked the director of the CDC to terminate some of these senior long-term staff that were insisting on basically controlling the agenda for the upcoming ACIP COVID subcommittee work group and what they would be allowed to consider as they would investigate and make recommendations to the director of the CDC concerning the 3 COVID vaccine products that are currently on the agenda for discussion at the upcoming ACIP meeting, which Bobby has insisted occur in September and is now finally scheduled for the 18th and 19th of this month. So stay tuned. If you're enjoying the last week, you'll enjoy the week of the 17th and the 18th even more. And with the decision apparently by the secretary coming out of the meeting with the director to ask the director to vacate her position. And then last Wednesday, the Washington Post came out with a brief breaking news article that, in fact, the director had been asked to leave. Near as I can tell, I think it's 4 CDC personnel, senior personnel, resigned almost immediately after that announcement. And in the resignation letters asserted again the narrative that the secretary was politically interfering with the science at the CDC. This then reaches this point where we're at today, where this morning I had conference calls with the other members of the ACIP COVID working group, but we have 4 meetings scheduled because we have to jam all of our hearings in between now and when we have a slide deck available for the other ACIP members and draft recommendations that'll be rolled out during the 18th and the 19th. So everything is compressed like, usual. It all got delayed because of this slow walking. Now it all has to be done in a very short time frame. And we're not going to be able to do a very comprehensive job on that. Last week, the secretary also announced that the emergency use authorization for the COVID products had finally been rescinded. The medical emergency had been declared ended months ago, but they managed to retain the EUA authorization for these products, even though there was no longer a medical emergency, and that's finally ended. And so now we have termination of that and 3 products authorized, Moderna, Pfizer, and Novavax, in short, for limited indications of basically elderly and populations at high risk of at least one high risk factor, undefined by the FDA what that meant, which is part of the remit now that's been tossed into the lap of the ACIP, because we're obligated by statute to advise the secretary at the meeting following any FDA determination about a vaccine.
Robert, one quick sec. We're going to take a break, and folks, we're going to be right back. And we're back with Dr. Robert Malone, author, physician, scientist, medical advisor to MAHA Action, and volunteer member of the ACIP committee. Robert, from what Dr. Levy, what Retsev said, it seems like they wanted to keep any discussion of COVID vaccine injury out of the scope of the work that the subcommittee was going to do. Now, explain that to me.
I'm perplexed also in that the subcommittee is supposed to be independent of the agency. This is fundamental to the FACA, the Federal Advisory Committee Act. The FACA structure is supposed to allow outside experts to independently assess and advise key personnel and decision makers within the federal government. But the position taken by these individuals that have resigned, apparently, was that, in fact, they were the ones that were authorized to determine what the scope would be for the ACIP's investigations and decision-making. And that the CDC had gathered all the necessary data concerning adverse events and effectiveness of these products, and that those data from the CDC were available for the ACIP to evaluate, and that it was out of scope for the ACIP to consider other sources of information. That, I think, is a perverse interpretation of the charter, but it is the clearest indication of how we got to this point, where the ACIP had basically become a mouthpiece for the interests of both the CDC bureaucracy and the pharmaceutical industry. Because
as opposed to a check, on the system, because really that's what it's supposed to be,
as opposed to being an independent assessment and advisory to the director, which is what the charter is.
So where does that leave Dr. Levy and this subgroup, which I understand is going to be meeting soon?
So our first meeting, I think, is tomorrow, and then another one on Friday, and then 2 next week. So now those folks that were obstructing and insisting on controlling the process and the scope are no longer there. And new people have stepped into those roles. And as Recep Levy, Dr. Levy, elaborated in this notable interview, currently, all indications are that we will be able to move forward as partners with these CDC personnel, and that is absolutely our approach to this. There are those that insist that there should be some accountability for these actions, but from the standpoint of the committee, it's not our job. We're not in charge of accountability, or it's also not within our mission and remit to assess or do fact-finding on any things that might have occurred over the last few years. Our focus is going forward. Our focus is on the current circulating strains of SARS-CoV-2, on the currently available products, and advising the director of the CDC on what the data show as the safety, effectiveness, and utility of these products should be, and to follow the data wherever it should lead. So current discussions include, all of those that will be testifying to the subcommittee may well include some members of the prior subcommittee that was terminated under the secretary's order when the ACIP was retired and the new one rolled in. We're absolutely on board with having a full diversity of opinion and commentary, and it may well be, looking forward, I speculate that there may be a presentation to the general ACIP and the public that has bullet points for those that are advocating current policy and those that have testified about things that might cause reservations about current policy. And what's on the table is what would be recommended. And the recommendation range of options for ACIP is really pretty constrained. And it doesn't include, Maha Base, it doesn't include throwing them in jail. It's very straightforward. We can recommend that these vaccines be administered in alignment with what FDA has authorized. We can recommend what's called shared decision making, in which there must be a discussion and informed consent between a physician and the patient or the caregiver that is responsible for the patient. So a father, mother, etc. for the child. And then there is the option of no recommendation. And certainly if, for instance, a request to the director of CBER to share with the ACIP the data he and his staff used to support the decision to authorize these products for these populations, it's reasonable that the ACIP should receive that same information that the FDA used in their decision making. Otherwise, we can't really know what was the basis of the decision. We also, you might imagine, would very much need to receive the documentation about what constitutes a special population or a population at high risk. It's not good enough to just say anybody that's high risk or has one risk factor. Well, define what that is. And what are the data to support that? Not all risk factors are the same. If the committee was to make a recommendation here, there, or anywhere about shared decision making, that implies that there must be a dialogue and informed consent between patient or patient representative and the physician, prescribing physician. It also implies that these products would be available via prescription, but not necessarily you can just walk up to Walmart and get a jab in the butt or in the shoulder or whatever. So already a lot of the reports are that CVS and Walmart, et cetera, are pulling back from their campaigns for administering these various products. If there's going to be shared decision-making, there has to be informed consent. Why there doesn't have to be informed consent in the case of what is functionally a standard of care mandate, if the ACIP recommends and the CDC director endorses use for a particular indication, is beyond me. As somebody schooled in medical ethics, informed consent is the cornerstone of all medical practice. But that's how it's been interpreted. That's the system we have. But if we're going to move towards shared decision making, we believe that it's necessary, it's the responsibility of the ACIP to provide the physician with guidance about the information that must be shared with the patient.
Well, Dr. Robert Malone, it's such a pleasure to have had you on.
Thanks for having me on, Jan, and thanks for the opportunity to help your listeners navigate these challenging news cycles.
Thank you all for joining Dr. Robert Malone and me on this episode of American Thought Leaders. I'm your host, Jan Jekielek.